Hi class, welcome back. It's Dr. Lindner. So in a previous video, we introduced the plexi and we talked about the four different plexus that exist, the cervical, the brachial, in the neck. There's no thoracic plexus, they're just intercostal nerves. But in the lower back, we have the lumbar plexus and we have the sacral plexus. So let's take a look at the lumbar and the sacral plexus and focus on some of the important nerves, okay? So in the lumbar plexus originates from ventral rami, L1 through L4. And the two biggies that we should focus on are the femoral nerve and the obturator nerve. The femoral nerve causes, when it's damage to it, right, since the femoral nerve goes to the quadriceps, if there's damage, there's the inability to extend the leg because you can't control the quadriceps. And there can be loss of sensation to the thigh, especially when it's involving the lateral femoral cutaneous nerve. When there's injury to the obturator nerve, since the obturator nerve goes to the adductors, you're going to have paralysis of the thigh adductors. Okay. So here's the L1 to L4 region, right? That's where the lumbar plexus goes. And the ones that are important, the femoral nerve, the obturator nerve. Remember, the femoral goes to the quadriceps, the obturator goes to the adductors. And besides that, the lateral femoral cutaneous nerve. When this is damaged, it kind of gives you like a reverse sciatica. Most people know sciatica affects the back of the thigh and the back of the leg. When the lateral femoral cutaneous nerve is damaged, there's pain to the anterior lateral thigh. Sometimes this comes from what we call tight belt syndrome. Police officers that have a nightstick or a gun that's on the side of their leg that can compress it, wearing a tight belt, pregnancy, obesity, anything where you have constriction over the waist that's really tight can compress the lateral femoral cutaneous nerve, giving numbness, tingling, and pain to the outer and lateral part of the thigh. It's called meralgia paresthetica. Meralgia paresthetica. That involves lateral femoral cutaneous nerve issue. Let's look at the sacral plexus. The sacral plexus goes from L4 to S4. And this plexus, if you look at it, it goes anterior to the sacrum. And this is why when there's pregnancy and a woman is lying on her back, it's like a bowling ball that's right here. When a woman's lying on her back and you have 8 to 10-pound baby putting pressure on all these nerves, it's no wonder a woman can get sciatica or have challenges with pushing a baby out, right? Because all those nerves are being compressed. A lot of women prefer being upright, working with gravity, or in a birthing tub. Okay, much, much easier that way. So it's anterior to the sacrum. The biggie is the sciatic nerve. And let's look at this sciatic nerve. Here, we can see that the sciatic nerve is the thickest nerve in the body, right here. And you can see that when we look at its origin, it's like L4 to S4, but you can understand why when people have herniated discs, if this disc right here pushes, let me change the color here so it's a little bit easier to see. If this disc right here pushes out and hits that, or this disc bulges or herniates and hits that, if you're getting zings here, boom, you can get sciatica. So having degeneration or arthritis of the lower back, disc bulge, disc herniation, if you have a pelvic tilt or a sacral tilt, that can put pressure on the sciatic nerve. Even flat feet, because flat feet or pes planus of the feet can create internal rotation of the tibia and femur, which can put a stretch on the piriformis muscle, and piriformis can hit the sciatic nerve, creating another form of sciatica. So sciatica is just like saying that you have a headache. And there's different types of headaches: cluster headache, migraine headache, tension headache, hormonal headache, caffeine headache, fasting headache, right? So sciatica just tells us that there's irritation to the sciatic nerve, but it doesn't necessarily tell us the cause of sciatica. So the reason why I like this picture is it shows the sciatic nerve, and you can see the two shades of green because the sciatic nerve is really made up of two nerves, the common peroneal nerve and the tibial nerve. It's made up of these two. Okay. And I want you to see that on the right-hand side, we're looking at, this is the posterior and this is anterior. So you can see the sciatic nerve right here in the back, and right near the popliteal fossa, you can see that the sciatic nerve splits, right? There's a fork in the road. And what it's dividing into those two nerves, the common peroneal and the tibial. This is the tibial. It stays tibial all the way down the back till it gets to the calcaneus. And that's why when people get sciatica, it can shoot down to the buttock. It can skip the buttock and just go down into the leg. It can skip all of this and just go down into the foot, because the tibial nerve then splits into a medial plantar and a lateral plantar nerve. Okay, whenever we see common, the word common tells us that that nerve is going to split. So the common peroneal splits into one and two nerves. It splits into a deep peroneal and a superficial peroneal nerve. The deep peroneal nerve goes to all of the dorsiflexors, all of the dorsiflexors of the foot, like tibialis anterior, and the superficial peroneal deals with the sensation to the outer leg and the toes. That's why when you sit with your legs crossed, let's say your right leg crosses over your left thigh near your left knee, and you sit there for a while, the superficial peroneal can get compressed, and then your foot falls asleep. Okay. The superficial peroneal nerve, besides being a sensory nerve, also goes to the peroneus longus and peroneus brevis muscle on the side of the leg. Okay, so sciatica, we spoke about sciatica, can come from herniated disc, can come from spinal subluxations, which are misalignments of the vertebrae. It can come from piriformis syndrome, because the piriformis goes like this. It's on the back side. It goes from the greater trochanter, from the sacrum, in this way. So when it's tight, it can compress the sciatic nerve. If you have a tilted pelvis, right, if the pelvis tilts, because the sciatic nerve, let me erase this a second. Because the sciatic nerve travels here in that greater sciatic notch, if the pelvis tilts at all, it changes the orientation and you can get compression here. And if you have flat feet or pes planus, the tibia and the femur internally rotate, and that puts a lot of stress on the piriformis, causing sciatica. Okay, when we come back, I'll talk about dermatomes, okay?